application for about 20 seconds. Alright, so the first step was HF. Because this was 4%, that's why 20 seconds. What will be the next step?
Phosphoric acid.
Thoroughly wash it.
Thoroughly wash it. Thoroughly. And when I say thoroughly, not just air, not just water, but air, water together. Okay, next will be, after washing off the HF thoroughly with water, the next step is to go ahead and place 37% ortho phosphoric acid over the intaglio surface and keep rubbing it over for about 30 seconds. Then you wash that away with water as well. What's the next step? Silane / single bond universal. Okay, I prefer to use SBU. After having washed off the orthophosphoric acid, the next step is the application of single bond universal, which has a silane coupling agent incorporated in it. Thoroughly applied over the entire intaglio surface and all the prosthesis margins. Go ahead and air dry this and then keep it covered. It's very important that this not be exposed to sunlight, so as you can see, I'm going to keep it covered. Alright, always covered with something that's opaque. You don't want light to get in at all. Alright, I didn't have my 3-way close by, but air is very important. Why? Because solvent, of course. Another very important aspect is, if you look at most bonding agents, they look yellow in color. And then often you realize, if it's a very translucent material like Emax, the yellow of the bond can be seen through, and then your restoration looks yellow, very chromatic, and you don't like that. More than you, the patient doesn't like that. The patient says, "No, it looks yellow." What's your answer? Yellow? मुझे तो नहीं दिख रहा yellow. मुझे तो एकदम perfect. Right. One other important aspect is when you air dry, the solvent is being evaporated. What is yellow? The solvent. Often the solvent is alcohol. What is the color of alcohol? Hello? Dirty hello. Alright, so air dry. Alright, what's the next step now? Prosthesis is ready for bonding. Now you go to the right up to the preparation margin. As you can see here, doing the same thing towards the distal of the 6 that I am going to prepare. So going ahead and cutting this off. This allows me to remove the excess very easily. Also removing this horizontally. Perfect. So cutting this across the margin of the prepared tooth. What I also like to do is take a putty cutter, as you can see the J-hook shape, and create these sluiceways present on the lingual. This allows for the excess pro-temp material to flow across the lingual as well. This is how the putty is prepared and kept ready prior to the tooth preparation. Alright, so the putty cutter that you saw is from Colty. It's different for a right-handed individual, different for a left-handed individual. It's like a one-time buy. It works brilliantly when you're making generation adhesive system from 3M. It's important that we cover all the prepared dentin surfaces with it. So I go ahead, take my micro applicator tip and scrub over all the dentin that has been exposed as a part of my tooth preparation. All surfaces must be covered, all dentinal surfaces, that's very important. And we scrub it over the surface for 20 seconds. This is extremely important for the formation of the hybrid layer. All 360 degrees of the preparation, wherever dentin was exposed, that area has to be covered with the bonding resin. Once we scrub this for 20 seconds, we then go ahead and light cure the bonding resin. I'm going ahead and light cure this for about 10 seconds, thoroughly light cure. And once this is done, the last step involves the use of a water soluble jelly or a glycerin jelly to go ahead and block any oxygen inhibited layer. So what I am using here is KY jelly. I am, with the help of a brush, applying it over all the prepared surface wherever the dentin bonding agent was applied, and then once again go ahead and light cure this. This makes sure that there is no oxygen inhibited layer on the surface and that all your bonding agent is completely cured. Only once this is done do you wash away the excess and then proceed with making your impression. Now remember, if any bonding resin were to go over the enamel, this is the time when you selectively run your burr over the enamel, making sure you have fresh enamel, because you do not want enamel that's covered by your resin bonding agent. So just go ahead and run and freshen the enamel and then proceed with the impression in case the bonding agent has gone on to your prepared enamel margins. Right, two things in this, guys. First, this is dispensed on a mixing pad. Typically 2 clicks is adequate resinous material for 1 overlay prosthesis. We go ahead and mix this thoroughly. Typically between 10 to 15 seconds of mixing is recommended. Adequately mix the material into each other so that you get one uniform homogeneous resin mix. Collect this and go ahead and now load the intaglio surface of your prosthesis. Remember, it was covered and kept safe all this while. So loaded it in and then gently teased over the entire surface. Make sure the entire surface is covered with the resin material. Now you take this prosthesis to the tooth. Here it is ready. I'm going to place the restoration in position, press it down. As I press down, you would be able to see the excess resin flow out from the side. As you can see, this flowing out from the buccal, flowing out from the lingual. This is extremely important to make sure that there is adequate amount of material. Keep it pressed initially. What helps is to probably use a ball burnisher like this with a single point contact to hold the restoration down, and your assistant can do this while you remove the excess resin. To remove the excess resin, I prefer to use this brush. I'm going to go ahead and gently tease the excess resin out. It's a flat brush. Whatever is semi-soft can very easily be removed at this point of time from the buccal, also from the lingual. Tease it off completely, as much as is possible. There will always be a little bit of resin interproximally, and that's fine. Remove whatever you can yourself at this point. Once this is done, holding this down, making sure that it's held under pressure, you go ahead and tack cure. And it's very important to use a nice light curing unit. Just tack cure for 1 second each buccal and lingual so that the resin basically becomes semi-solid. This allows you to go ahead and clean the interproximals. What I love to do is roll the Teflon into a floss and then use this down into maximum intercuspation. What this basically does is it allows me to record the upper impression, the lower impression, and the patient's bite, all 3 things simultaneously. To make a one-step impression with the Bite Max, the first step is to go ahead and dispense the light body intraorally. As you can see, I'm using an intraoral tip to do the same. I dispense the light body around the margin of the prepared tooth, covering all 360 degrees of the surface, and then go ahead and submerge the entire tooth with the light body, making sure there are no air voids inside. Little bit of light body can also be extended on the occlusal and proximal surfaces of adjacent teeth. What I am using here is Express XT light body. It's one of the best light bodies that I have come across. Once this is done, I now load the tray. My assistant has done this for me. As you can see, the upper frame and the lower frame have been loaded with the putty and it has been squeezed at the top. I now place this into the patient's mouth, making sure the horizontal arm is distal to the terminal molar, and then have the patient bite down into maximum intercuspation. As the patient bites down into MIP, now you will be able to see that the upper impression, the lower impression and the bite, all three get registered together. My assistant puts the timer in front of the patient. Now what this timer does is it allows the patient to understand that for the next 4 minutes, which is the polymerization time of the material, the patient is supposed to bite in the bite max and not open the mouth at all. With the timer almost hitting 0, this is an indication that the material is completely polymerized. Now once this alarm starts beeping, what I tell my patient is to open the mouth wide. But before doing that, I will support this tray onto the arch on which the impression is being made. So because I'm making a mandibular impression, I'm going to support the tray on the mandibular arch. As you can see, I'm holding it like this and I'm going to ask my patient to open the mouth. So the patient opens the mouth wide. I can now retrieve this tray very easily. Now look here, you will be able to see an absolutely amazing impression of the mandibular arch where the light body has recorded all the preparation margins beautifully. You also have a putty impression for the maxillary arch, and of course you have the bite together. So what this triple tray technique does is it saves material, but more importantly it saves material from 3M that I am going to dispense into this cavitation for the first molar that I have prepared and run it across the entire occlusal surface. Just fill the entire cavitation with the desired amount of material and go ahead and then seat this onto the prepared tooth. Now, when you seat it down, make sure to press it adequately from the occlusal surface, from the buccal and from the lingual surface. And you go ahead and set the timer. The timer here is set for 1 minute 40 seconds. 1 minute 40 seconds is how long it takes for this material to completely polymerize. As you can see, the excess material flows out here and it creates a lump, and because it creates a lump, it makes it extremely easy for me to retrieve this excess out. This excess that is slightly hardened off can very easily be probed out. This allows for a clean margin to be achieved with the immediate temporary. With the 1 minute 40 seconds now complete, I go ahead and retrieve the putty index. And as I do that, you will be able to see how an immediate chairside temporary that mimics the original anatomy of the tooth gets recreated. Doesn't this look absolutely stunning? Now, very important is to understand that these are non-retentive preps. So we have to go ahead and follow a technique called a spot bond, which allows us to hold this temporary restoration onto the underlying prepared tooth. Can I cement this temporary with a eugenol-free zinc oxide? No. Molar for an occlusal veneer. I start with occlusal reduction. What I'm using here is the DC 1.0 burr from my partial bonded restoration kit. I'm going to go ahead and make depth grooves first, holding the burr along the anatomy of the occlusal surface, not flattening it out basically, just keeping it aligned with the tooth and the anatomy of the same. Making these depth grooves going full depth, because when I go full depth, I get an exact 1 millimeter of occlusal reduction. So I've made these 1 millimeter grooves on the functional cusp. I'm going to make similar grooves on the non-functional cusp. 1 millimeter here again, and then go ahead and make another one here. So basically these are at the height of the cuspal ridges. So 4 grooves typically made. Now what I need to do is go ahead and connect between these 2 grooves to start with. So I'm going to move from here downward and inward, from here downward and inward, thereby creating a V-shaped occlusal preparation. That's basically to follow the anatomy of the original tooth. Downward and inward. Downward and inward. Just keep doing it along one direction first. So now that I've connected the 2 grooves, basically what I have is a uniform 1 millimeter reduction over this surface. Now I need to reduce towards the proximals. From here towards the distal, from here towards the mesial. Now the concern during these movements is I may land up nicking the adjacent teeth. This is where I personally prefer to use something called as the fender wedge. This is what a fender wedge looks like. It is a wedge and it has a metallic extension. And when I'm working on the proximal surfaces of teeth, I prefer to use the fender wedge because I can push this through. And as you can see here, it allows for this metallic extension to protect the adjacent tooth, making sure that I do not land up creating any iatrogenic damage. So I now proceed with the mesial margin incline of my buccal cusp. So go ahead and extend this medioproximally out. Go ahead very gently, just pull it out and you will be able to see the entire temp in one piece. You can clearly see there is some excess resin flash towards the sides. So this is where you go ahead and take your soft flex discs and finish the proximal margins. With the soft flex disc, these areas can easily be
so soft flex will come in 4 different grades.
Can be removed.
Coarse, medium, fine, extra fine. I typically only just use the medium.
That's what I prefer.
That's it, for removing the excess. Because if I use coarse, I might land up over reducing. It's a soft material.
Remove all this excess flash gently. Don't be in a hurry to do this because you don't want to over trim. Do this towards the other proximal surface as well. Just round this off beautifully. Whatever flash that you see, just run it across. You don't want any excess beyond the margin of your preparation. And the soft flex disc works beautifully in this particular context.
This is basically removing the excess and finishing, both things together. It also removes the oxygen inhibited layer that's present on this surface. This will prevent your provisionals from staining very easily. Else you can almost predict patient ne kal kya khana khaya.
Alright, with that our provisional is finished. All we now need to do is polish it. The next step involves the use of a diamond polisher, which is run over all surfaces.
So medium grade soft flex disc